Nicola Hill, who joins us live from London. Nicola, how is the virus affecting children? What are some of the unique challenges in treating children?
Well, first of all, let me just say this study that we've just been talking about, the ONS study of the nearly 11,000 people in just over 5,000 households, actually showed that there were 33 people in 30 households who tested positive for COVID-19. It's a very small number. This is the big pilot study that's going to expand. But it did show, as you said then, that it didn't discriminate. Children seem to be just as likely to be infected as adults. And this backs up research we've had from China and from other countries over the past few weeks. Now, I was speaking this morning to Dr. Ravi Jairam. He's a paediatrician at a large children's hospital here in the UK. He's a children's doctor. And he said this doesn't surprise him. He sees a number of children who've come into the hospital with a variety of symptoms, not just the cough and not just the high fever. They might have rashes, they might be a little sleepy, babies don't want to feed. That's made him suspect they've got COVID-19. But because of the policy, you only swab, you only test if you're admitted to hospital. He can't confirm this. So what he's been doing is sending them home with their parents and telling their parents to self-isolate for 14 days. And also he has had children in hospital for other reasons. They have been tested for COVID-19 and they've come as positive tests, even though they weren't necessarily in there for that. So it's showing us that children seem to have the disease, but in most cases, they possibly are not infected as badly as adults, mild and moderate.
What's with this rare inflammatory disease that's being linked to coronavirus in children? Do doctors know why it's happening and how to treat it?
At the moment, they don't know the full details. They say it's very similar to Kawasaki disease or toxic shock syndrome. Now, Kawasaki disease is usually seen in children under the age of 5, and it's when it's a reaction to another infection and it causes a multisystem problem. But this syndrome that's being seen, now they're actually calling it a different name. They're calling it pediatric inflammatory multisystem inflammation. Quite a mouthful. But they're seeing this in children up to the age of 16, which is unusual. And the numbers are very, very small. 8 children in London were seen with this last month. So all children doctors here in the UK were asked to look out for it. So far in the UK, about 100 cases have been identified. Parts of Europe, other countries in Europe, they've also spotted it, and in 15 states in America. Now, it can be treated, like if children might end up in intensive care, but it can be treated. But it's not known the full details. I mean, this is just yet another thing, part of the coronavirus that specialists are investigating.
This must be really concerning for parents. Is there anything that they can do to protect their children? I mean, we know, of course, social distancing and washing your hands, but children, of course, aren't always going to remember to do that. And children like going outside and playing and getting dirty. Is there anything specific parents can do?
Mainly what they're being told to do is to be vigilant. And this is something that Dr. Jairam said to me, that he really wants parents to be aware of that message. Don't panic, but if you do think that your child's poorly, seek medical help. Go and see your primary care physician or go to the hospital. You know, a lot of people are avoiding this. They're so worried about getting COVID-19 that they're not going to the doctors, they're not going to the hospital. And Dr. Jairam says, don't do that. You know, if you're concerned about your child, you must seek medical help. But yes, as you said, it's, you know, these pictures we've got of children playing. I mean, children don't understand being 1 or 2 meters apart, do they? So it's being vigilant. It's trying to ensure that they do wash their hands, but to keep an eye on them.
Okay, we'll leave it there. Nicola Hill in London, thank you.